country. In the spirit of reconciliation, the ECCV acknowledges the traditional custodians of country throughout Australia and their connection to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. About the content of our presentation, we will be talking about ECCV and what we do and what is the community outreach project working in here. And we will be talking about what is COVIDSafe plan, what are the basic principles of COVIDSafe plan. There will be a detailed explanation about government rules and regulations. We will be explaining about QR codes and how to set a QR code system. And then there will be an example of a COVIDSafe plan. We will be explaining the steps about conducting COVID-safe activities. There will be some signs, posters, templates, and resources available for our community to simplify these terms. And of course, there will be an expert from Worksafe Victoria who will be explaining and highlighting the most important part of COVIDSafe plan. At last, there will be a question and answer session. If you have any doubts and questions, we will be giving you a chance at the end of the session. But if there is any question during the session, please pop them up in the chat section and we will try our best to cover them all. So who we are, about ECCV. Ethnic Community Council of Victoria, ECCV is a member and Victorian representative council of the Federation of Ethnic Communities Council of Australia, that is FECA. We are the voices of multicultural Victoria, strengthening and building our community through advocacy and leadership, empowering people from culturally diverse backgrounds. Our vision is to build a culturally diverse and harmonious society that is just, fair, and inclusive for all Victorians. And in regard of community outreach project, it is a part of ECCV and Working for Victoria project. We have been working and reaching out to CALD communities, culturally and linguistically diverse communities, to identify the issues, problems encountered during the COVID outbreak. And we were finding out the impacts on the, analyzing the impacts that has got on them. We also assist in referral services, that is, we are connecting communities to various level of support services available in their local area. Also, we had been engaged with Worksafe Victoria to educate business communities on COVID-19 and workplace safety. So the actual topic of the event, what is a COVID-safe plan? Your COVID-safe plan must demonstrate the actions to prevent the contraction of COVID-19 in your organization. It will highlight the importance of personal protective equipment that are required to keep yourself safe in your organization. It also explains your responses and preparations to suspected or confirmed case of COVID-19 that is going to happen in your organization. And it is all about meeting all the requirements set by Victorian government. Requirements varies as per the organization, their interaction level, their type of work they are involved in. And these requirements need to be updated as per the changes in government rules and regulations. Principles of COVID-safe work plans. There are 6 principles that we have to follow while developing a COVID-safe work plans. And that number 1 is ensure physical distancing. As we all know, 1.5 meters of distancing in between person-to-person contact. And we have to ensure that we are wearing a fitted face mask as per the current public health advice. And then there will be a practice good hygiene thing. That means frequently and regularly cleaning and disinfecting shared spaces and high-touch communal items, and keep record and act quickly, which explains that we have to keep the record of all people who will be entering our work site for contact tracing and support workers to get tested, and stay home even if they have mild symptoms. Avoid interaction in enclosed spaces. That said, move as much activity outside as possible, including meetings and lunch breaks, tea breaks, etc. And the last one is creating workforce bubbles. That means keep group of workers rostered on the same shift at a single work site and ensure there is no overlap of workers during shift changes. We will just touch a little bit about government rules. All the community facilities are open at the moment, and the activities they are free to run their activities. Either they are indoor or outdoors. And there are certain measures in place. That means you must be wearing a fitted mask when you are in public indoor spaces. Similarly, there are rules such as 2 square meter rule, 4 square meter rule, and even 8 square meter rules are implemented in certain places. And there is a free QR code services system that need to be used by the businesses and the community services. So these terms and the rules and regulations will be further explained by our expert later on. Now I will directly jump into explaining the steps that need to be followed while we are setting QR codes. So first of all, you need to begin registering over at a Victorian government QR code service via Coronavirus Victoria website. Once you have accepted the terms and declared the information is correct, you can click register and you will now receive an email. Confirm your email address by clicking on the link, and then you will need to set up a password to log into the QR code service portal. The portal is the place where you create and manage your QR code service. There will be certain password requirement that you need to follow, after which entering your password twice, you can click change password. And now you can start filling in details of your organization or your event or your industry. Then after that, you have to, if your club or event have more than one locations, then your next screen will help you to specify each one and create individual QR code for each locations. And if you have to specify the primary contact person for each location who will receive QR codes and instructions for that specific location. And also, if your organization has more than one area or your event has more than one area, you should specify each area. And then if your organization operates from more than one location, register as many locations as you need to. So once you have completed these steps as many times as you need to, then you have to click register, and you are now registered as along with your venue or event. So your account is now set up, and you will now see the QR code registration homepage. And following those simple steps, you can manage Victorian government QR code service system and record visitors for contact tracing and keep yourself and your workers safe. Thank you. And I would like to stop here and would like to invite my colleague Suzanne, who will be walking you through an actual COVIDSafe plan for one of our community-based organization. Please, Suzanne, you are most welcome. Thank you.
Thank you very much, Dipmala. I would like to start with the example of COVIDSafe guidance. The picture that you can see in this slide is the picture of guideline that is called Guidance for Coronavirus COVID-19, Planning in the Community Services Sector. This document is prepared by Department of Health and can be easily downloaded from Google if you type the above topic. Now, this one is the template of COVIDSafe plan, which you can get from the above guidance document. Before moving forward, our expert person, Tony, will be explaining more deeper. And I'm going to provide you all a walkthrough on developing a COVIDSafe plan for one of our community services organization. And this template starts with business organizational details, such as business name, site location, contact person phone, and date prepared. Then there is a guidance on various categories, and your organization need to mention the action based on this guidance that could mitigate the introduction and spread of COVID-19 in your organization. For example, under hygiene section, it says provide and promote hand sanitizer stations for use on entering building and other locations in the worksite, and ensure adequate supplies of hand soap and paper towels are available for all staff. And in our mitigation actions, we can say there will be a cleansing station stocked with these supplies at the entry of our organization, and antibacterial wipes, paper towel are provided in the bathrooms. Hand sanitizer is available in several locations throughout the center. Similarly, next one is where possible, enhance airflow by opening windows and adjusting air conditioning. Our organization always encourage to keep the windows open. And next is in areas or workplace where it is required, ensure all staff wear face covering and or required PPE. Unless a lawful exceptions applies, ensure adequate for covering and PPE are available to staff that do not have their own. And provide training to staff on the correct use and disposal of face coverings and PPE, and on good hygiene practices and slowing the spread of coronavirus. For example, posters are displayed on arrival, a cafeteria and the kitchen on good hygiene and the correct way to wash, sanitize your hands. And replace high-touch communal items with alternatives that community center already provided cloth tea towels with the paper towel. And under the cleaning section, increase environmental cleaning, including between changes of staff, ensure high-touch surfaces are cleaned and disinfected regularly, at least twice a day. Currently, members are visiting in the office and cafeteria, and instructions as to keeping themselves safe have been issued already. Ensure adequate supplies of cleaning products, including detergent and disinfection. Stock of hand sanitizer, antibacterial wipes and soap, disposable masks and gloves are reviewed on attendance at the office and at arrival. Under physical distancing and limiting workplace attendance section, please make sure, ensure that all staff that can work from home and do work from home. For example, all members are currently being supported visiting the center in a small group, and the community organization is encouraging them to visit center as a small group. Establish a system that ensures staff members are not working across multiple settings, worksite. This is not applicable for community organizations. Establish a system to screen employees and visitors before accessing the workplace. Employers cannot require employees to work when unwell. For example, that community center has purchased thermometer to check temperature on arrival at the center. And configure communal work areas so that there is no more than one worker per 4 square meters of enclosed workspace, and employees are spaced at least 1.5 meters apart. Also consider installing screens or barriers. Currently, board members having meeting time to time following social distance rules. Use floor markings to provide minimum physical distancing guides between workstations or areas that are likely to create a congregation of staff. The hall has been marked to provide social distance for funeral services and other stage performances. That community center is one of the faith center. That's why they are serving funeral to the public as well. Modify the alignment of workstations so that employees do not face one another. In cafeteria, tables are placed following the government 2 square meter rule. And minimize the build of employees waiting to enter and exit the workplace. During the funeral services, people are encouraged to queue and maintain 1.5 meter distance while entering and leaving the premise. Provide training to staff on physical distancing, expectations while working and socializing. This is not applicable. Review delivery protocols to limit contact between delivery drivers and staff. Physical distancing must be maintained by the member of signature is required. review and update work rosters and timetables where possible to ensure temporal as well as physical distancing. This is not applicable for that community center as well. Where relevant, ensure clear and visible signage in areas that are open to the general public that specifies maximum occupancy of the space as determined by 4 square meter rule. This is not applicable. And under the record keeping guidance, establish a process to record the attendance of customers, clients, or visitors, and workplace inspectors, delivery drivers. This information will assist employers to identify close contacts. Management has provided a manual sign-in book and also used government's free QR code service, and provide guidance to staff on the effective use of the workplace occupational health and safety reporting system. Currently, occupational health and safety protocols are followed, and members are encouraged to take care of themselves while visiting the center. Preparing your response to a suspected or confirmed COVID-19 case. Prepare or update your business. Continue to plan to consider the impacts of an outbreak and potential closure of the workplace. For example, that center is currently opened after a successful implementation of their service. Continue to plan and COVIDSafe plan. Prepare to assist Department of Health with contact tracing and providing staff and visitor records to support contact tracing. Their center have QR code system and manual sign-in book calendar. Prepare to undertake cleaning and disinfection at your business premises. Assess whether the workplace or parts of the workplace must be closed. And next is prepare for how you will manage a suspected or confirmed case in an employee during work hours. I would like to explain this more detail, such as members are required to declare they have no symptoms prior to visiting the center and will not be in the center with others. Should a member notify by the management that they believe they have the virus and they are either in a face-to-face meeting with other members or at the center, they will be directed to return home and self-isolate while they get tested. If they are too sick to go home in the same manner they came to the center, such as car, bike, or walking, an ambulance will be called by the management board who has been notified. And next is prepare to notify workforce and site visitors of a confirmed or suspected case. And prepare to immediately notify Worksafe Victoria if you have a confirmed COVID-19 case at your workplace. And lastly, confirm that your workplace can safely reopen and workers can or members can return to visit the center. The community center will keep the center open following current government guidelines and will stay up to date with the future changes and announcement. And lastly, you have to put your name, full name, signature with date to understand and acknowledge your responsibilities. That's all from my side. Thank you so much, Dipmala. Back to you now.
Thank you. Thank you, Suzanne. It was very informative session, and I'm sure our audience has got some insight on developing a COVIDSafe plan, and they will prepare one for their organization if they haven't done yet. Next, I would like to call on my another colleague, Martin. He will explain and share information about the steps to follow while conducting activities in a COVIDSafe manner, along with some important resources and services. Please, Martin, you are welcome.
Thank you, Dumala, for welcoming me. I will be talking about COVIDSafe activities. These are the practical activities we are doing in our normal life. Before I start talking about these COVIDSafe activities, I would like to say COVIDSafe activities are activities that are related to our normal life. These activities involve COVIDSafe plan. As Susan as just mentioned earlier, how to prepare COVIDSafe. You must have a COVIDSafe plan in place before any event takes place. Always check local regulations. These regulations are related to COVID hotspots. For example, what number of people are allowed to assemble in any event or in meeting, whether outdoor or indoor gathering. Stay at home. We are all aware what the Department of Health says what to do. If we are not feeling well, we should stay at home. We always comply with the following rules by maintaining 1.5 meters distance from others and wear a fitted mask if you cannot guarantee this distance when you are outside. Cover sneeze or cough. Wash your hands frequently after you touch your face or different places. Coming to gases, the organizers or the person in charge of the event must always provide procedures to be followed before the event starts or during the event. About the precaution to be observed by the participants by ensuring that they are followed, such as entry arrangements, departure times when people exit the parties, including sitting arrangements, floor marking, how people move in or out. That must be a procedure people have to follow. When it comes to the events, if you choose the outdoor events are more recommendable instead of indoor events because they are safer. If you conduct the event inside indoors, you must ensure that there is enough ventilation. Coming to number of people, we always advise to minimize crowding. That is by allowing a reasonable number of people attending the event. Provide necessary supplies. These supplies include hand hygiene station, hand sanitizer, soap, water, tissues, clothespin, distance markers, and face masks. Coming to useful signs, posters, and templates. These useful signs, posters, and templates are found in government website for any business or organization to have them in their centers to make it easy for community members to understand the COVID restriction. Like these keywords, always, these are the signs can be understood by any member of the community. Does your business have a COVIDSafe plan? Or distance makes the workplace safer? Feeling unwell, please stay home. These are the posters people can just get the message clearly straight away. Keep a fitted mask with you always when you are out. Know who is who at work or at home or for any event for easy tracing records. Have a meeting in an Frasco is a meeting that is conducted at open space with the fresh air flowing. Again, when we talk about posters, there are other posters that talk about in different languages. If someone wants to understand COVIDSafe plans, there are other posters in different languages. We can just access them by using the different languages. How to keep the hygiene or how to keep our business open or distance. Finally, we have support services. These services have multilingual COVID safety related information These service providers include the ECCV, the one we are presenting today. We do support community members regarding issues relating to COVID. There is Coronavirus Victoria. Also, there are information about COVIDSafe. Coronavirus online in 24 hours is also available by calling the 1800 numbers. We there can see. There is also TIS, that is for translation for those who cannot understand English. They can be supported by translation. And then 000 for emergencies is also available. Again, we have pre-infection control training. It is a short accredited training that helps staff identify and manage the risk of COVID infection in the workplace. COVIDSafe plan also in other languages is also available in government website. It can be accessed by those who understand the COVIDSafe in different languages. It can be found in Victoria State Department, stakeholder part. At these junctures, I would like to stop here and welcome back my colleagues, Demala, to continue with the next program. Thank you.
Thanks a lot, Martin, and for your enlightening presentation. Our community leaders and members will follow those steps and utilize those resources and start meeting face-to-face in a COVID-safe manner. Now, the most crucial part of our event, we are going to invite our expert from Worksafe, Tony. He has got an extensive knowledge and experience in the COVID-safe, working safely in COVID-19 field. So without wasting time, I would like him to come forward and share his insightful presentation on COVID safety. Thank you. Welcome, Tony.
Thanks, Deepmala, and everybody, and thank you everybody for the invite to come along and present to you. I'm going to have a PowerPoint come up on the screen in a second. So I'm a Worksafe inspector. I've been in Worksafe for 5.5 years now, and I think the whole of 2020 was spent just purely on COVID and visiting many workplaces around COVID. Just the next slide there, Rahel. So what I want to discuss with you tonight or this evening is Worksafe Victoria's role with respect to COVID-19, workplace current requirements. So I just want to give you a very brief overview of the requirements at workplaces. Just a little bit of guidance on how to complete a COVID-safe plan, which is a very important document. We'll talk a little bit about getting help, and then just find out if anybody's got any questions they would like to ask. So I'll just go on to the next slide. So a question that we get asked quite often is, why COVID-19, the virus itself is something that's affected, the whole of Australia, in our personal lives. And so sometimes we get asked, well, why does Worksafe get involved with managing COVID-19 risks? And the reason being is that all Victorian employers have a legal requirement to provide a working environment for their employees that's safe and without any risk to health. And one of the new risks that have just been introduced to us is COVID-19 risks. So, part of those requirements for creating and managing a safe workplace is identifying and controlling any risks that might relate to the exposure to COVID-19 at the workplace. So that's why we get involved, because COVID-19 has not only hit us for our home life, but our work life as well. So just on that next slide. So some of our roles during the COVID-19 pandemic, and I must say too, is that while it's been a new experience for all of you employers out there. It's been a new experience for us as well. So, you know, it's been a very, very quick and intensive learning curve for all of us. It's been a very fast moving and changing environment on, you know, on a daily, if not weekly basis, around how we can keep ourselves safe and what the government requires us to do as well. So, but some of the roles we've played, one is providing advice and guidance for Victorian workplaces. Has been a very important role for us, as well as ECCV. Monitoring workplaces to ensure that they're complying with COVID-19 restrictions that are set by the Victorian Chief Health Officer, and they've changed constantly throughout the process. I think we're up to the set of restrictions we're up to now, or directions, I think is 21 or 22. So they're things that change constantly. Ensuring that when a COVID-19 case is detected in the workplace, that the risk of further cases is carefully managed. So, as mentioned before, you know, as soon as a case is detected in a workplace, there's a requirement to notify the Department of Health, but also to notify Worksafe. And of course, we go out immediately and look into how that case has come about, and what further control measures perhaps can be implemented to prevent, you know, more cases happening at that workplace. And another role, obviously, is that we intervene where workplaces are not complying with COVID-19 restrictions. So we get phone calls on a daily basis to our advisory line. Sometimes those phone calls are from employers who are ringing to get advice and ask for help. And other times they're phone calls from people, either members of the public or employees, who are concerned about risks in that workplace and maybe are seeing things that aren't being managed carefully or properly in their eyes. And so they make a complaint to us, and of course we're required to go out and make some inquiries and ask questions to see if there is a risk there. And if we identify a risk, you know, we also have a responsibility to try and help that organisation in addressing the risk. Just the next slide there. So just an overview of current restrictions. There's basically, you could sum it up in that all workplaces have really only two requirements right around the COVID piece. One is to manage the risk. And of course, that can be broken down into many areas such as masks and distancing and things like that. But one requirement is to manage the risks. And then the second requirement is to detail how you're going to manage the risks in a document that we call a COVIDSafe plan. So the COVIDSafe plan just simply outlines what you're going to do or what you are already doing at your workplace to prevent COVID from coming to your workplace. So that's all the plan is for. Just in red there on that PowerPoint, I've just put I guess a bit of a special note, which is a very important one, and that is employers, under our legislation, employers are required to consult with employees on all health and safety matters. So, that includes developing a COVIDSafe plan. So, consultation means that you're trying to get the employees involved in developing the plan. And, if you've got a workplace where the employees may not necessarily have the skills to help you, at the very least is that consultation also means developing your plan in a draft format and providing it to the employees and giving them the opportunity to give you feedback before you implement the plan. And you'd be surprised at the feedback that you get from the employees. I know in my experience before I came to Worksafe, of working as a health and safety manager at a lot of organisations, often it's our employees that come up with some of the most simplest solutions that often cost the least amount of money to implement. So, it's a legal requirement, but it's a beneficial requirement in getting your employees involved in that process of developing your plan. And when you get them involved, you'll find that implementing the plan is so much easier as well. The second one there is mask use. Mask use is still required in some environments, not too many now, but I've just put a few brief ones down there. All shopping centres are still required to have mask use. The retail stores inside of a shopping centre are still required to have people use masks. In very large retail stores, so if the store is over 2,000 square metres, such as a Bunnings store, that's why we're still required to wear a mask when we go into Bunnings. And a market or market store are required to still have mask use. So that might be things like the Queen Victoria market or the Preston market and places like that. Now, outside of those ones that I've listed as mandatory, all workplaces are still required to have everybody wear a mask if you can't maintain the 1.5 metre distancing. So every workplace out there, aside from the ones on that slide, if you can't maintain the 1.5, then we're required to wear a mask. And as an inspector, I do go to many places where it is still impossible to maintain that 1.5 distancing. Yeah. Just the next slide there, Rahel. So density quotas, you may have heard that terminology come up. It's a bit of a strange words, and a lot of people, we come across a lot of people that don't understand what that means, density quotas. But density quotas is just all about setting the maximum number of people that are permitted in an area. Sometimes that area is a room, or it could be a large space. So, for example, at your workplace, you might have a lunchroom, and that lunchroom might measure perhaps 20 square metres. And so based on the 2 square metre rule, that means that you're only allowed to have 10 people in there at a time so that we can maintain that distance. And as an employer, you've got a requirement there to set those distances and then have signage on the entrance, all entrances to that area or that room, that specify what that maximum number of people is permitted in that room. So you'll find that when you walk around many businesses, a retail store or different office environments, you'll start to notice, if you start to look for it, signage at that entrance saying no more than this amount of people are allowed in here. So for most places now, it's been brought from 1 person for every 4 square metres down to 1 person for every 2 square metres. So that's good. We can have a lot more people in indoor places. And this includes pubs and restaurants and cafes that are both indoors and outdoors. So the 2 square metres is for outdoor areas as well. And those restrictions, we can bring it down to 1 for every 2 square metres if we've got electronic record keeping of the people that visit there. So if we don't have electronic record keeping, then it actually jumps back up to that 1 every 4 square metres. Beauty services is another one that's there, and retail businesses. If a person has a cafe or a restaurant where the number of people is no more than 25 people, so it might be a little cafe where you've only got seats for 15 people, and in those cases, then there's no capping at all required. So regardless of how small it is, you're allowed to go up to the 25 people if that's all that can fit in there. And again, down the bottom, I've just popped in there that you need signage at the entrance showing the maximum number of people that are permitted in there. Just the next slide. The 4th one I've put in there is that you need to increase your normal cleaning practices. And this is for what we call high touch areas. So a high touch area is surface at a workplace that many different people might touch during the day. And I've given some examples there of being door handles and microwave handles and kettle handles and fridges, FPOS machines, toilet buttons and toilet taps. So, you know, at your workplace, you might have a cleaner that comes in perhaps once or twice a week, you know, to do the vacuuming, and they do the cleaning and everything. And that would still continue on. The increase in cleaning that we're required to have in a workplace doesn't necessarily mean that that cleaner has to do what they're doing more often. It's only around the high touch areas. And the expectation there from the Department of Health and for WorkSafe is that the high touch areas are sanitised at least twice per day. So there's very specific chemicals that you need to get for doing that. They are readily available. You can go on the government website and get a list of those chemicals. But to give you an example, Glen 20 in a spray can, which you can buy from any supermarket, is one of those chemicals that has been shown to kill the coronavirus that may be on surfaces at work. And really, you're looking for any shiny surface like glass or stainless steel that different people touch during the day, and somebody needs to be assigned to spray those surfaces and you know, give them a good clean with a rag that would get thrown away at the end of it a couple of times per day. So, you know, if someone was running a 7-Eleven store, for example, and by the way, the 7-Eleven stores, they sanitize all high touch areas every hour throughout the whole day, and they keep a record of it as well. But, you know, if you were just doing it to the requirements of DHS, as an example, you'd be required to spray the FPOS machine, the fridge handles, maybe the telephone, if there's a, you know, public phone in there. What else? The microwave oven, the Slurpee machine, or the coffee machine that multiple people are using during the day. So they're the type of things where you would sanitize it several times per day. Just the next slide there, Rahel. Contact tracing, so keeping a record of employees at work every day, which we normally do because we've got to pay them. And the other thing we have to keep a record of is just to clarify with the visitors, when you get visitors to your workplace, you're only required to keep a record of them if that visitor is there for more than 15 minutes. So if you have a delivery person come and drop off some stock that you might sell at your business, and they drop it off and you sign for it and they go, and that delivery driver has only been there for 2 or 3 minutes, you don't have to record their details. That's not to say don't do it. It's good practice to record all people that come there, but the requirement from DHS and certainly from WorkSafe is only if they've been there for more than 15 minutes. Yeah. Just the next slide there. Just back one slide. That's it. And just before I go on to the COVIDSafe plan too, the QR code that's been mentioned a few times already by our colleagues with the ECCV, the QR code is, there's different ways of recording people who attend a workplace. And one of the most common ways is by having a sheet, a piece of paper that's, ruled off with lines where the person records their name and their contact phone number. And that's still an acceptable way of doing it. As a means of making it easier, the government has brought out this QR code system. I've certainly visited a lot of places that still use a paper-based system, and that's okay for us as a WorkSafe inspector. The QR code system is a beautiful system, and it does make it easy. The only downside I've found with the system is that, as a workplace, when you're dealing with the elderly, it's often that, the elderly don't know how to use a QR code system, or they don't have it on their mobile phone. Or when you're dealing with people, it's, where English is their second language. Again, they may not understand how, the customer that you might have may not understand how to use a QR code system, or may not have one on their phone. So I think it's very important that even if you do have a QR code system, you've also got that clipboard with some paper that people can write on as well, in case they don't have the QR system on their mobile phone, so that they've got the option of using either system there. So those strategies that I talked about are the most common strategies that you're required to have at a workplace. There are little things underneath that, like, if you've got a workplace that's required to use face masks, then there's also a requirement to have a sign when you're entering that workplace telling they must wear signs. So, there's little things underneath that are requirements. But that, what I've talked about so far is your strategy. The next thing is that you must document that strategy, which is what a COVIDSafe plan is. The COVIDSafe plan can be seen in different forms. The most common one I see is the one I've got on the screen, which is available on the Victorian government website. It's a beautiful template to use, but there are other templates out there. And of course, if I go to a workplace where they're using a different template, that's fine. I don't have a problem with that, so long as they've documented what their strategy is. The other thing I've just popped at the bottom there, which is very important, is that the plan is being used and it's up to date. So it's no use having a plan from 6 months ago that says everybody must wear a mask if that's no longer required at your mask. So very important is that as the government's changing the rules, which is good, and it's good that we've got these rules in place. I was going to tap into that before, but as the government's changing these rules, you have to make sure you update your plan. But just on that, I just want to tap into that just very quickly, because a lot of workplaces look at these rules as very painful and hard and everything. And one thing I often point out to many workplaces I go to is that we should be very grateful that our government has stepped in and provided a lot of guidance on a lot of these rules, because not only is our economy started recovering already, our economy is already showing very good signs of recovery from COVID, but we're in Australia and in Victoria, we're leading the world, and very similar when we had the global financial crisis, the GFC. We're going to be one of the very first countries that emerge out of COVID with a very, very strong economy. And the reason is because the government stepped in very early with some strong rules to get rid of COVID out of our community. And I think, as a community, we've done very, very well. And we're going to reap the benefits over the next few years compared to all the other countries around the world. So I'm grateful with how our government has reacted to COVID. Just the next one there, Rahel. So just very quickly on how to write a COVIDSafe plan. Like I said, there's lots of templates available. And I believe, ECCV are able to point many of the communities in the direction of where there's templates around. I've just popped a web address there for where this plan is available. And on that actual page, if you scroll down, you'll find the template that you can download. Rahel, we'll just go to the next slide there. And with this plan, and very similar with a lot of plans out there, including the one that we were shown before from Suzanne and from Martin, is that on the left-hand side of the plan, it gives you an explanation of what you should be implementing at that workplace. And so therefore, on the right-hand side of the plan, where you can see all the blank boxes, that's where you write in what you're doing at your workplace. It doesn't have to be typed in. So don't feel you have to type it. I come across many where they've just written it in by hand. I'd suggest you use somebody who's got neat handwriting is important, but don't feel you have to type it in. Just look at it that the left side gives you guidance and the right side is where you write. As we saw with the one that Suzanne had and Martin had before, some of the things may not be applicable at your particular workplace, and you just simply write in there, not applicable. But, you know, if I can give you an example, it might talk about cleaning and having a cleaning regime. And so when you come to the side where you write something, you might write something as simple as, we're using an approved cleaning agent to disinfect high-touch areas such as, you know, door handles, toilet handles, and water taps. And we've assigned an employee to do this twice a day. That's all you have to write. You don't have to, you know, write a whole, book on how you're doing it. Just a very brief description on how you're managing that part of the process. Just the next slide, Rahel. With this particular template, which like I said, I think is a very good template, on the same website or the same page, if you scroll down further, as you can see here, it's actually available in many languages. So, you know, if you've got a specific language that is, you know, the most spoken language at your workplace, it makes sense to grab a template in that language, because the people that have to benefit out of that, what you're writing in your COVIDSafe plan, are the people at your workplace. Not people who are visiting your workplace, but the people who work there. So there's nothing wrong with writing it in that language for that particular workplace. I think we've got 1 or 2 slides to go. Yeah, so you can get, there's so much help out there, so much information. And I've popped a couple up there, but there's a web address there for translations in different languages for getting help around COVID-19. And that's not just with the COVID plan, but that includes other advice around COVID-19. We've got the Worksafe advisory line, and I've popped the phone number up there. Something very important with the Worksafe advisory line is that when you ring up that advisory line, you can ring up anonymously. You don't have to tell them who you are. You don't have to tell them where you're from. So you don't have to be scared that, if, you know, when you ring them, someone's going to turn up on your doorstep. It's not the case. You're just ringing them up. And I know in many years before I joined Worksafe, I used to ring that phone number often. You know, perhaps, you know, 3 or 4 times a year, I used to ring that number. I never told them where I was from. I never told them my name. I just said, I want to get some advice on this. And they gave me advice over the phone. And if they didn't know what the advice was, they would tell me where I could go to get advice. And that's how the advisory lines work. So you don't have to tell them who you are. There's a hotline there that the government has set up for COVID-19. And I've popped the phone number there, and they'll provide assistance. I know ECCV provide assistance as well. They've got phone numbers and information that can be provided to you in many languages. And look, I could probably have filled out that whole page on where you can get guidance and advice. And the other thing I often advise people too, I had to go to the Preston market to visit, just do some random visits at workplaces around the Preston market. And I used to say to all the people there at the Preston market, when you're filling out your COVIDSafe plan and you get to a section where you don't know what it's asking you, or you don't know what to write in, which is, it's bound to happen. It happens to every workplace. Don't be scared to go to your neighbour, you know, and ask them what they wrote in there, or what they're doing. You know, I don't expect that every workplace out there is going to know straight away what to write in their plan. But, you know, my strong advice is, when you don't know what to write, just ask for help. There's so many people within our community, within Worksafe, within ECCV, that are more than willing to help you, complete your plan so that you've got something that, is as accurate as you can get, and will you manage your workplace so that you don't have, the risks there. And the other thing to keep in mind too is that if you have a COVID case turn up at your workplace, apart from needing to manage it from a employee perspective so that it doesn't spread any further, it's going to impact financially on your business too, because chances are that the Department of Health is going to force you to close down, for it could only be 2 or 3 days. But I know of workplaces that had been closed down for weeks and weeks before they were allowed to reopen. So, preventing it from coming to your workplace in the first place is always going to be the best measure. And you're, as business owners, you're the first, port of call there. You're the first layer of defense in preventing it from, from emerging at your workplace. So, is there any, the next slide that was going to come up was, are there any questions or of either myself or anybody from ECCV around what I've explained to you there? If not, I'll pass it back. I'm going to hang around till the end of this session tonight, but I'll pass it back over to Debmala.
Thank you. Thank you very much, Tony. It was very insightful, very simple, and very clear. It was like just for the community people and the small businesses, it was very clear for them to understand the detail that the complications that was around the COVIDSafe plan, and like what is it, like how do we create it, and then your explanation clear, it makes it very clear. Thank you for that. And now we are finished with our presentation, and we are just at 7, but we would like to welcome any questions, if there's any questions, concerns, anything to be for us or for Tony or Suzanne, Martin, anybody. Is there anything in the chat box, if anything is there?
You must have explained it well, Deepmala.
Yes, there is no concerns and no questions there. So I think, we were very clear and there is no doubt at all.
Can I just ask a question to Tony? I'm just interested in how many queries you get from businesses. Do the majority of people know how to fill out the plans, or do you get lots of questions? And if so, what are the most common ones that you get?
Yeah, I'm sorry to say, Diana, that's a question I can't answer because our advisory line is a very, very big department. I've been in there a few times to help out. I would suspect there might be 50 or 60 people working there. How many inquiries they get per day, I don't know what that number is. And I don't know what the common questions are. The only thing I know is the questions or the things that I see are missing when I go and do an inspection, because when I go to a workplace purely for COVID, often 9 times out of 10, the very first thing I ask for is a copy of their plan. And then I read their plan from start to finish before I do anything else with that inspection. And in doing that, often obviously I come across things that might be missing from the plan. And I've got to say, I shouldn't even say often, because it's probably only, for me, maybe 1 in every 10 where I might provide some advice on something either missing or something needs to be updated or clarified. I do come across a few where people have just put NA instead of writing out something. In some instances, it's because they didn't have to do anything in that space. But in other instances, I think I get the impression they wrote NA because they didn't know what it meant and they didn't know what to write. And so I've discussed that with them and given them some advice, and have updated it. So I don't come across too many myself, Diana, but how many come into the advisory line? Yeah, I don't work in that department, so, and I haven't seen any numbers, unfortunately. Yeah.
Thank you. Thanks for that.
No worries.
If there's no further questions, then I think we can end our session. Thank you very much, Tony, for coming over and explaining it in detail. It was a very fruitful session. And thank you, Rahel, for helping us in the technical part. And thank you to everybody for participating in our workshop. Thank you very much.
Thank you, everyone, for the invite, and good luck with the recovery, into 2021 for all of you.
Thank you, Tony. Thanks.
Thank you, Tony. Thank you.
Everyone, taking your time.